Vince here with Team Mexico. I'm joined with Alexis Muller and Madison McCown, and we would like to take a couple minutes and provide you with a small skit on what it might be like when caring for a cultural Mexican-American family. What you'll notice from our Prezi is the mention of a folk illness called Mal Ojo, and we mentioned this a couple of times. What we've tried to do is demonstrate what it would be like to care for one of these families that believe in this folk illness. And we're going to show you the incorrect way in managing the care for these families, and then we're going to show you the correct way in managing the care for these families. So first, what we'll show you is the incorrect way, and then afterwards the correct way. So please enjoy.
Okay.
All right. The strangest thing happened in my patient's room today. I'm not sure how I could have handled the situation better in order to respect the patient and her child.
What
happened? Can we help?
Well, I was caring for a Mexican-American child whose mother was present. She appeared very frightened and insisted that I hold her child. It was so hard for me to understand her because of the language barrier, and I was in such a rush to update the whiteboard that I didn't use the language line. When I told her I would be right back, she kept telling me Mal Ojo, but I have no idea what it means.
Maybe she's just scared that her child is being hospitalized.
Yeah, I wouldn't worry about it right now. Just get your documentation finished and go back when you have more time.
Okay, so that was the incorrect way in managing the care for these patients. What we're going to show you next is the correct way that's going to provide the culturally competent care that we should expect to be provided to these patients. That's going to be the most beneficial for them and their family members. So please enjoy. Thanks.
The strangest thing happened in my patient's room today. I'm not sure how I could have handled the situation better in order to respect the patient and her child.
What happened?
Well, maybe we can help.
Well, I was caring for a Mexican-American child whose mother was present. She appeared very frightened and insisted that I hold her child. It was hard for me to understand her because of the language barrier, and I was in such a rush to update the whiteboard that I didn't use the language line. When I told her I would be right back, she kept telling me Mal Ojo, but I have no idea what that means.
Well, let's look up Mal Ojo and maybe we can get a better understanding.
Okay, Mal Ojo, which is also known as evil eye, is a folk illness that affects infants and children. It is believed that an individual possesses a special power voluntarily or involuntarily and injures a child by looking at it or admiring but not touching. The spell is broken or prevented when the individual who possesses the evil eye touches the child. The signs and symptoms are crying, fever, vomiting, loss of appetite, and treatment is having healthcare worker touch the child.
Sounds horrible.
Wow, I had no idea that was what was frightening her.
Madison, you should go back into the patient's room and this time use the language line and apologize for being insensitive, but explain what happened and offer to help the mother.
Yeah, I think I will go back to apologize and do my best to respect the patient and the mother's cultural diversity.
Okay, so that was our final section of the skit here, where we show you the correct way in managing the care for these patients. I hope it was a little bit enlightening. And from here, we'll let you get back to our Prezi, and thanks for watching.